My name is Molly Chidawanyika. I am going to be talking about abuse in care settings. This is abuse especially by caregivers against the people that they are entrusted to care for. I've had some knowledge on abuse, especially in facilities that provide care for vulnerable people, having worked in the industry for many years myself. Legislation that protect vulnerable individuals have come into place and have changed over time. I have also witnessed the transformation of care provision over time. What is abuse? According to NHS South Yorkshire Trust, abuse is any action that violates a person's human or civil rights. It can take many forms and involve a number of factors. Abuse can occur anywhere, and the abuser can be anyone. It can be a stranger, a carer, a family member, health professional, or anyone else in a position of trust. Any persons depending on another individual are considered to be vulnerable and susceptible to abuse. Types of abuse. There are many forms of abuse, and the following are some of them. There is physical abuse, there's sexual abuse, financial or material abuse, neglect, institutional abuse, emotional and psychological abuse, abandonment and exclusion, self-neglect, domestic violence or abuse, and modern slavery, to mention a few. People with care and support needs, such as older people or people with disabilities, are more likely to be abused or neglected. They may be seen as easy target and may be less likely to identify abuse themselves or to report it. People with communication difficulties can be particularly at risk because they may not be able to alert others. Sometimes people may not be aware that they are being abused, and this is especially likely if they have a cognitive impairment. Abusers may try to prevent access to the person they abuse. Signs of abuse can often be difficult to detect. Many types of abuse are also criminal offenses and should be treated as such. Watchdog organizations like Care Quality Commission, CQC, which is a regulator, monitors and inspects all organizations providing care to ensure standards are being adhered to. All NHS and social organizations have to be registered with the CQC and have to conform to a set of standards. Abuse can happen once or can be repeated. And where there is lack of appropriate action against the perpetrator, this can go on and on. This always occurs in any relationship where there is an expectation of trust, and trust which is breached, resulting in harm or distress on the victim. Abuse in any form constitutes to a violation of human rights, and it leads to serious loss of dignity and respect. Rates of abuse are high in institutions such as nursing homes and long-term care facilities. Abuse can lead to serious physical injuries and long-term psychological consequences. Abuse is predicted to be on the increase because many countries are experiencing rapidly aging populations. The global population of people aged between 60 and over will more than double from 900 million in 2015 to about 2 billion in 2050. Reports say neglect has got the highest percentage of abuse, with a percentage of 58.5, followed by physical abuse, and then financial exploitation and emotional abuse, and all the other forms of abuse follow after. Abuse has become a very important public health problem. In 2017, a report based on evidence from 52 studies in 28 countries from diverse regions, including 12 low to middle income countries, estimated that over the past year, 15.7% of people aged 60 years and older were subjected to some form of abuse. The study says this could be an underestimation, as only 1 in 24 cases of abuse is reported, in part because victims are often afraid to report cases of abuse, especially if perpetrated by carers, family, friends, for fear of further victimization. Consequently, any prevalent rates are likely to be underestimated. Although rigorous data is limited, the study provides prevalent estimates drawing on all available studies of the number of victims affected by different types of abuse. Abusive acts in institutions may include physically restraining patients, depriving them of dignity, like leaving them with soiled clothes and choice over daily affairs, intentionally providing insufficient care, such as allowing them to develop pressure sores, over and under medicating them, and withholding medication from them, and also emotionally neglecting and abusing them. Abuse can lead to physical injuries ranging from minor scratches to bruises to broken bones and disabling injuries. Sometimes these injuries can be long-lasting and have psychological consequences, including depression and anxiety. For victims in the older age range, the consequences of abuse can be especially serious, and the convalescence period takes even longer. Even relatively minor injuries can cause serious and permanent damage or even death. A 13-year-old follow-up study found that victims of abuse are twice more likely to die prematurely than people who are not victims of elder abuse. On a global scale, the number of cases of abuse is projected to increase as many countries have rapidly aging populations whose needs may not be fully met due to resources constraints. If the proportions of victims remain constant, the number of victims will increase rapidly due to populations that are living for much longer. Risks at the individual level include poor physical and mental health of the victim, and mental disorders, alcohol and substance abuse. Other individual level factors may increase the risk of abuse, include the gender of the victim, the situation with living conditions. While older men have the same risks of abuse as women, in some cultures where women have inferior social status, elderly women are at a much higher risk of neglect and financial abuse. When they get widowed, women may also be at a higher risk of more persistent and severe forms of abuse and injury. How can a society prevent the prevalent abuse numbers? Many strategies have been implemented to prevent abuse and to take action against it and mitigate its consequences. Interventions that have been implemented mainly in high-income countries to prevent abuse include public and professional awareness campaigns, screening of victims and abusers, caregiver support interventions, residential care policies that define and improve standards of care, and training of caregivers and enlightening them on what is abuse, as some of them may not even know that they are abusing people. Some people do it probably in innocence, so they need to be educated as how to identify and what not to do to perpetrate acts of abuse. Efforts to respond and to prevent further abuse include interventions such as mandatory reporting and abuse to authorities, self-help groups, safe houses and emergency shelters, psychological programs for abusers, helplines to provide information and referrals, caregiver support interventions, and on a global scale, little is known about abuse and how it can be prevented, particularly in developing countries. The scope and the nature of the problem is only beginning to be brought to light. Many risk factors remain contested, and the consequences and evidence for what works to prevent abuse is very limited. Abuse is a very broad term, and indicators of the types of abuse mentioned before are wide-ranging according to the type. Please note that not only perpetrating an abusive act, but not reporting acts of abuse also constitutes to abuse. By this, I mean that if anyone witnesses any act of abuse and does not report it, but keeps it to themselves, that person is also perpetrating an act of abuse. That is also a topic for another day, because it is very important to identify that an individual is being abused and to know what to do about that kind of information. The other thing that makes recognizing a bit difficult is that while a stranger can abuse a vulnerable person, abuse is more prevalent with family, friends, carers, anybody that is close to the victim, because for this group of people, accessibility is easy. That is why the policies of safeguarding are put in place to protect even the closest person from a vulnerable person. Safeguarding is about keeping people safe from harm. It is a policy that protects the vulnerable, and this includes protecting their rights to live in safety, free from abuse and neglect and exploitation. It is also about keeping abusers away from victims of abuse, because abuse is a deliberate act of ill treatment that causes harm. A person can be abused through harassment, insults, or similar actions due to race, religion, gender identity, age, disability, and sexual orientation, which also shows that people, even who might not be seen as quite vulnerable, can also be abused due to other factors too. And in conclusion, according to the National Council for Aging, about 1 in 10 Americans aged 60 and older have suffered at least one form of abuse that we have identified earlier on. This is according to the National Center for Elder Abuse. Knowing the different forms of abuse can help to identify the signs of abuse, and also to help the victim from subtler forms of mistreatment. Recognizing abuse, monitoring it, recording and reporting to relevant authorities have helped to curb the numbers of people from all age groups that are and can be potentially subjected to abuse. Thank you very much for listening. I hope this has been a bit helpful to somebody and who could be suffering abuse, and somebody who knows somebody who is. Thank you very much.